Yes, ma'am.
Shall I start?
Yes.
Okay, good afternoon everybody. सभी दर्शकों को नमस्कार. आज हम नई श्रृंखला सीरीज शुरू कर रहे हैं. Warm welcome to all the viewers, who are watching us live on various platforms, YouTube, Facebook, everywhere. Good to have you all here. See, the thing is that if you see the flyer for today's program, you will see two important words, which is dialogue and debate. Now, let me tell you the idea behind this is that many of times till now, we have witnessed debates a lot in last 2 years. And what I felt as a doctor was that we should have a dialogue also, because along with debates are of course important. Scientific debates do help us a lot, but dialogue, जिसे हम आचार विचार की लेन देन बोलते हैं, so that is very important. And especially when all the practicing doctors, clinicians, come together and share their views and thoughts, so एक अलग नजरिए से we get to see that topic. So this today's program is all about let's have a dialogue and not a debate, because there is always a difference. And most importantly, somebody has rightly said that what we have to think about is not who is right, but why we are together here is to know what is right. So the whole theme today is on that. Now, first, I would like to introduce my speakers, who are all clinicians today. So let me take their names first and introduce them. We have with us Dr. Pradeep Sethia. He is MD Homeopathy.
Hello.
Dr. Ramya Krishnan. She is also MD plus PhD in Ayurveda, Associate Professor in Ayurveda. Hello, Dr. Ramya.
Namaste. Namaste. Hello.
Dr. Saurabh Mishra. He is BNY's graduate, that is into naturopathy, and he's a yoga physician.
Correct. Hello, everyone. Namaste.
Dr. Sudhir Jagtap.
Namaste.
He is MD
Hello,
Medicine,
everyone.
consultant physician. And myself, Dr. Gayatri Pandit Rao. I'm a homeopathic physician. So we all are doctors here together. Hope we'll have a good time, and even viewers will have good time to listen to us. So now we start with the program. See, there's always past, present, and future, isn't it? And what is important is past is always important, history, because present is mostly based on what we did not do in the past, isn't it? And future is always dependent on the present, that what we are going to do today, because all future is going to depend on that. I hope you all agree. So first we will go back into a bit of history, which is not very good. Everybody has gone through a lot in last 2-3 years. It was never to be forgotten type of days. So I will give 2 cents from my side in the beginning to start with. Me being a homeopathic physician, as we all know, this pandemic or COVID began in 2020. And, initially all doctors were not much aware in first couple of months, because if anything new comes up, there is always, even a doctor who is practicing on a very grassroots level in his own local area or cities need to grasp what is going on. So it took couple of months to everybody of us, understand what the whole picture is about, कि ये कहाँ जा रहा है. And slowly the word came as Mahamari. And we were all perplexed that, there were patients coming to me also. I was having a lot of different kind of picture. Different in the sense, what I was seeing everywhere in newspapers, social medias, and what I was thinking. Because when patient came to me, most of the patients were like, they used to come for their own stuff with me since years. So I knew them personally also. And looking at the disease picture and all, I was not pretty sure that what these people are saying, or the narrative, mainstream narrative, was very different than what I was thinking at my end. So, slowly, I started doing a bit of analysis, like what is really going on. And eventually I started finding bit of flaws in many things, logically also, as well as scientifically. So slowly, a picture started building up, and I felt like raising concerns. And eventually, the main important thing was that we all doctors were always scattered during those days because of lockdowns and everything. So the connection between doctors was very scarce. It was only on WhatsApp and something like that. So how to reach to them, that was also another big thing. And we were trying to build up picture on what was, we were able to see on the screen, on the television or the newspapers, or so then came the testing thing, that RT-PCR and everything. So that also was a big stuff that I never felt that patient needed actually RT-PCR, because it was, not a regular test. Now, everybody here will agree to me that usually, for now, even I'm practicing since last 15 years, and we never came across something, for a common fever, coughs and cold, or, even high grade fever. I don't think we ever suggested go and do an RT-PCR, because hardly we knew about it then. But the time came when the similar patient who came in those period, we started asking, to go and do the test. And fun part was that because of traveling and everything, patients used to call me and say, now I have to travel, so I need to do this RT-PCR, but I'm having no symptoms. And I just couldn't help. Actually, that was very bad thing. A doctor couldn't help, and doctor couldn't say that do not do this test because I'm not feeling so, but because officials are feeling so. So that was very bad part which I went through. Another was the fear aspect. So many patients used to, call me on phone and ask me n number of questions. Do you really think that this is all happening is true? Do you think I should go and do the test? Can homeopathy do something about it? Will I feel better? So these were constant WhatsApp messages coming and everything, So totally the picture was very different, and most of us doctors really felt helpless. What is to be done? How can I help my patient as a doctor was the biggest question I feel during those days, which I felt. So uh, I feel I'm quite junior to all the clinicians who are present here. So let's first hear to the senior people here. So one by one, I will ask each of the doctors to share their experience about the past first. Okay. So I think we'll start with Dr. Ramya. Can you
Thank you,
share?
Dr. Gayatri.
Yes.
And thanks to Awaken India movement for this noble initiative. I would appreciate each and every member of this. So the thing is that as you have started very well, Dr. Gayatri, for me also it was little bit shocking. I came to know first about this from NDTV. I didn't want to spoil that very thing as it is. I didn't want to change anything, so I noted it. I first saw the report from NDTV dated December 15th, 2020, where Health Ministry told that AYUSH and homeopaths can prescribe immune boosters and preventive measures and not as treatment or advertise anything as cure. This is what I saw first. So till before that also I was treating viral fevers. I am a practitioner with an clinical experience of 20 years, 21 years. So for me, there is no difference between COVID or H1N1 or dengue or something. According to Ayurvedic principles, an Ayurveda physician is supposed to diagnose and treat. So I have been treating all the viral fevers before, during, and after also, not considering as the name COVID or something. But this was shocking to me, mainly because I am a registered practitioner. I'm a registered medical practitioner. I have undergone professional education of BAMS, MD, and PhD. And as we all know, a registered medical practitioner is one who possesses any recognized medical qualification of India and of Indian Medical Council Act 1956, whose name has been enrolled in State Medical Register. For the sake of public, I am speaking this. And we have two important rights. I would like to read out that rights. One is right to choose the patient. Every system doctor is having the right to choose his patient. Once he begins treatment, he cannot refuse to withdraw this without any acceptable reason. That is one. And second one is very important. He cannot refuse to give treatment to anyone. He cannot refuse to give treatment to anyone. This is really important. Being a doctor, being a qualified doctor, any system of medicine, he has the right to diagnose and treat. So what I felt is it is something very distressing, because such a rule is came. It is depriving our fundamental rights, right? Fundamental right 21 is there of Constitution of India. Right to life and personal liberty is there, and also even right, article 42, article 21 and article 42 also, where the constitution directs the state to just and human conditions of work, just and human conditions of work. So I felt that both this right to health also, right to health, every citizen of India has the right to choose his own medical system of choice as per the charters of patient rights published by Ministry of Health and Family Welfare in the date 38/2018. Ministry of Family Welfare has published charters of patient rights as per the will of it. So all these rights are getting denied. And also proportionality, that whenever a new thing is implemented, there should be correct balance between restrictions imposed and civil liberties and human rights, which is also getting violated. Civil rights are not getting respected. So I have been treating so many patients till this. I found this news. I have been treating viral fevers, so it doesn't make any sense to me in that point of time. Till this point of time, I'm not feeling any sense to with regard to this statement that I cannot treat or I cannot claim anything as treatment to be given to a patient who is approaching me with a viral fever or an infective fever. For me, COVID-19 is not something unique, because our system has different rules to diagnose, what you call treat, everything, to estimate the prognosis, everything. So for me, as such, altogether, it was a shocking experience. But what I would like to conclude on this point by telling that I was continuing my treatment. I didn't deny any patient who approached me to help from viral fever, in any condition, let it be mild, moderate, or severe, because they are coming to us for treatment. When somebody calls it treatment or management or whatever it is, cure or whatever it is, being a doctor, it is my fundamental right to provide justice to my patient. And true to my heart, I didn't fail in doing that till today, because I don't want to lose my identity and professional dignity for the reason of something which is not justifiable. This is my point. Yeah.
Thank you, Dr. Ramya. Dr. Saurabh, please
Yes.
share your views also and
Yeah.
experience.
Yes. So I would like to state that during pandemic time, I used to follow Dr. Remya and her work, and I was very much relieved that someone is following. Actually, someone is practicing their pathy as it is, and not not getting ruled by other protocols and all. So I was also against all this protocol, and I somehow intuitively knew that whatever is happening right now is not related to disease or something like that. Okay, and whatever disease has come is nothing new to us. As a naturopathy physician, it is not a new thing. We have a different view when we see a disease. We have a different view. Uh, So they used to say there is a new virus, so no pathy has any cure to it or any treatment to it. Whatever they were doing was experiment. They are still finding out what is the cure. And in the form of cure, they bought something. And because of that, I felt we were forced to not practice our own pathy. We had to believe that something is there because for us, virus and all doesn't matter. The most important thing is the patient. Okay, what symptoms they are getting is what uh, what is happening to the patient is very important, rather than some kind of new virus has come or something like that. As a physician,
Right.
and for us, it is also wrong to decide a protocol, right? Because every patient has different needs, every patient has different things. And during pandemic, I could not work. I was in Mumbai and I was jailed in my house. And even my parents would not listen to me because it was so much propaganda. So much. It was fear mongering. And our own parents don't believe in us because so many people are dying according to media, and so many cases are there.
True.
So what I was doing, I was just reminding everyone that there is hope. इतना भी dangerous नहीं है कुछ, इतना भी डरने वाली बात नहीं है. You can just relax for some time, okay? And जो भी symptoms थे, it was not new. Breathlessness होना, taste चले जाना, right? It was very identical to influenza and flu. So we were not worried. But what I did was just to motivate others and to reduce the fear during that time.
Right.
Yes, that was my
Okay.
my thing.
Thank you. Yes, Dr. Pradeep Sethia.
Yes, thank you, Gayatri and Dr. Krishnan and Dr. Saurabh. I think we are on the same footstep rather as regards the approach of our systems for the treatment of COVID. The journey started with confusion to confidence because for everybody it was new thing basically. But that does not mean that others are not understanding and only some people are understanding it. As we got the patients and their emotions along with that, we understood that the disease is narrow, the fear is very broad. And being a homeopath, I could sense that we have to first give confidence to the patient and choose a medicine as per the symptoms. So the name of disease hardly matters for the pathy because it is symptom complex which guides for my remedy. We have got 30, 40 attested remedies for influenza from the Asian influenza till today. We have got H1N1 earlier, now COVID. And Council has given one remedy as a genus epidemicus in homeopathy, that is arsenic album. Now, that is not curative,
Yes.
everybody knows that. But then stitching time saves now is a principle. And if any pathy can follow that principle, one of the paths is definitely homeopathy. And so that was a medicine which was suggested as arsenic album and it was given to community at a large. The drawback was that it was given free, casually, just distributed. So there is no seriousness about that. So people could not take a cognizance as a scientific community that this is helping you. That's the reason these paths like homeopathy are always taken for granted. As opposed to that, oxygen was a costly affair, remdesivir was a costly affair, plasma therapy was a costly affair, and it was a hype, rather the glamour. कि अरे मुझे मिला है नहीं मिला है like that. That was not the case with this kind of a medicines. That is point number one. Point number two is that when patients come to us, we understood that they are in a panic state, and if that panic is taken away, improvement will happen fast. For that, due to preach by the words, I attended my clinic every day during all those 2 years without missing a single day. So that is the important thing, to have a patient face to face. Online treatment, on-screen treatment, telephonic call. This fear will increase the fear of a patient also. Why this stand was not taken? Doctor is allowed to remain at home and treat. That was their choice ultimately. But then I attended my clinic, and 50% advantage was that I was face to face to my patient. So they felt very happy that my doctor is with me. If he can be with me face to face, things are not that serious, because I have 10 times more risk than my patient. But I followed just basic things which are must as a part of law and rule, but then nothing overdoing out of that. And that helped me a lot in my treatment of a patient. Then comes the issue of treatment. See, when there is no treatment, there is treatment for every pathy. That's a tragedy. And that was a stage with the COVID syndrome, basically. And so from allopathy to Jalaneti, everything was tried. I'm very clear in my words, everything was tried. And everything was successful also. Then why do you have different standards for different approaches? We just want to say that every path has its scope and limitations. Some can work early, some can work late, some can work for prevention, some can work for strengthening the constitution, some can work in emergency, like a arrangement for that crisis situation. But out of 100 situations, 90% are not crisis, 10% are crisis. We are giving a color to all cases like a crisis. And that was the biggest flaw in that management of COVID, I feel, basically. Very small story was like this, which always I want to share about the viral diseases. It is not new to us. The name of virus can change, the approach never changes. So plague virus was very rampant in old days, and the plague virus was traveling from one city to another city, and there was a report news that many people are dying in one village, the other village, the next village. So ultimately, at one village, people catch hold of that virus and ask that virus that, "What do you plan over next village?" The virus said, "I'm going to kill 1,000 people." So people said, okay, doesn't matter. So they sent the news to next village. The virus went to that village, and about 10,000 people died. Way back when this virus was coming, the people halted this virus and said, "This, you have cheated us. You said 1,000 will be killed, but we came to know that you killed 10,000." The virus laughed and said, "No, I am very honest. You know, organisms are very honest. This is a very honest. They are democratic. They don't breach the rules." So this was a plague virus. So he said that I just killed 1,000 people. The remaining 9,000 died of a fear. So the message is very clear that we have to be very careful about individual approach, the person-wise treatment, and if that is taken care of, people will generate a confidence. Herd immunity has two dimensions: the herd immunity due to the vaccines and the herd immunity due to public contact or the relationship one person to other. कि कई विशेष नहीं है, कुछ ऐसा डरने की बात नहीं है. मैं भी ठीक हुआ हूँ, आपको भी दवा लेके ठीक हो सकता है. That can be a good sharing. And if I think if follow this in future, all pathogens can work complement to each other. I think that's my experience and thought process about the last year's COVID. Thank you.
Thank you, sir. Yes, Dr. Sudhir Jagtap. He is very senior to us here. He has 40 years of clinical practice at his hands, though currently, couple of years he's not practicing. But still, his views and thoughts as a clinician with his so big experience is going to help us understand, I feel. And he being from allopathic background, so we are very much eager to hear to his response to this, how his thoughts were during those days. Sir, please share.
Namaste to all of you, and special thanks to Dr. Gayatri for including me in this program. Yeah, I passed my MBBS from Pune BJMC in 1982, and since then, like, I am in medical practice. But for the past 5 years now, I have stopped allopathy practice for various reasons, but one of them is that allopathy has failed the society in clearing or giving us a healthy society. If we look at the society today, When I joined medical college in Pune, there were only 2 medical colleges. Now there are so many, I even don't know how many there are. The number of doctors has increased, but the health of the society seems to be going down and down. Like, this is paradoxical. If the doctors' number is increasing, their technical skills are increasing, their so-called scientific knowledge is increasing, and still we are having so many health issues in the society, then somewhere we are making some mistake. We are not going in the right direction. Now, coming to the flu, my own experience, when we were students, we were taught that flu, if you treat, it will be cured in 1 week. And if you don't treat, it will take 8 days. You're getting my point, no? So whether you treat it or not, it is a self-limiting disease. That is my personal experience. And that is why there are so many various methods of treatment, because that disease itself is self-limiting. And my understanding of after so many years is that influenza is not a disease which has to be feared, because the mortality is very low. In fact, influenza is a nature's cleansing agent. See, the body which cannot be cleaned by the routine methods of elimination of toxins like urine, sweat, breath, stool. These are the routine methods of eliminating unwanted substances from your body. But say over 3-4 months, 6 months, like everybody gets flu in 3 to 6 months, twice a year. Why is this happening? Nature is not stupid. Nature wants to cleanse the body, and the virus is there to cleanse you. Whenever we get a viral fever, what are the things that happen? We get a running nose, we get cough, we get phlegm, we get sweating, high-grade fever, sometimes vomiting, sometimes loose stools. So all these things are trying to throw out unwanted substances from the body. So my understanding is influenza is a self-limiting detoxifying mechanism which has been there in nature for since life is there. Human beings are there. So this whole episode of COVID was a very well orchestrated money spinning drama. That is all I can say. You know.
Sir,
And
is there any network issue?
hello. Hello. Hello, can you hear me?
Yes, yes, yes.
Okay.
Okay. You're done, sir?
Okay, yeah.
You want to speak
This
more?
is my, I'll conclude my this thing.
Yes, please.
Hello. Yeah. So viral fevers, especially influenza, is a self-limiting disease. That is my personal opinion. And statistics and everything will substantiate that. I'm a clinician. I'm not a statistician or a scientist or something to give you proofs. But you can see that all people who get flu, now some people will die because nature has decided that this body cannot be detoxified. The body, even though it is not apparent from test, the body may be so defective that nature cannot repair it. That is why there is death. Otherwise, nature is not going to finish that body if it can repair it. And nature is the one who is going to repair it. Doctors have to give up this idea that we are the people who are curing people. No, we are just agents to guide the people. See, the word doctor, now I don't want to appear smart, but how many of us know the real meaning of this word? See, I can confess that even till my MD, I did not know the real meaning. The real meaning is teacher, acharya. Yeah, that is why a PhD is also called a doctor and a medical doctor is also called doctor. Because the real meaning is teacher, and we have to teach the society how to be healthy. We are in the grasp of what is called the sickness industry. All of us, unfortunately, are part of that sickness industry. And the wellness industry is totally separate from this. People like Baba Ramdev or Acharya Mohan Gupta, you must have heard of these people, or Dr. Khadarwalli, or there are so many people who are teaching people how to be healthy and how to use natural resources as medicine. No, I will just enumerate, and later on, if I get a chance, I will see. Sunlight is a very good resource which is available without any cost. Then water. Then food itself is a remedy. Ayurvedic people will be able to say more of this. And in food, not eating is a remedy. Langanam paramaushadam. That is what Ayurveda teaches. So, interval, just changing the interval of how often you eat or fasting itself is a remedy. Then proper sleep, proper exercise, proper mental attitude. These are things which will get us out of the grasp of the pharma industry. The pharma industry has made us believe that only they can supply remedies. And that is totally false. So I will elaborate if I get time. That is all I want to say. Thank you.
Okay. Thank you, Dr. Sudhir Jagta. Meenakshi, can we just have the Times of India article? Just to conclude with this talk, we will just rewind our memories. If you see the date, it is December 2, 2020, the article. Ayush medics can prescribe drugs for COVID prevention. Is that what government had said? And let's read. It's just 2, 5, 10 sentences. The Union government on Tuesday told the Supreme Court that Ayurveda, Unani, and homeopathy practitioners can prescribe drugs for prevention of COVID-19 by boosting immunity, but cannot claim that their medicines can cure such patients. So very important statement. I'm repeating it. They are saying that we can treat or prescribe drugs for prevention of COVID-19 by boosting immunity, but cannot claim that their medicines can cure such patients. Solicitor General Tushar Mehta informed the bench of Justices Ashok Bhushan, R.S. Reddy, and M.R. Shah that Ayush practitioners have been provided with norms to prescribe drugs for boosting immunity or for symptomatic treatment of COVID-19 patients. While approving the medicines, the Ayush Ministry had clarified that it could not be claimed that these medicines can cure COVID-19. The bench said that all Ayush practitioners must adhere to the norms. Ayush Ministry said homeopathic medical practitioners were permitted to prescribe drugs as mentioned in the guidelines as an add-on to the conventional treatment for patients who had tested positive. Since it has approved prescription of homeopathic medication as an add-on treatment, the only embargo is that the said medicines should not be administered or advertised as a cure, but should be administered as preventive measure, immunity booster, it said. Each and every sentence of this article is like I sometimes feel it's like a slap to all the hardships that a doctor takes during Meenakshi, you can have everybody into one frame also. That is also good. Isn't it? It's like it's just a slap on our face when we are spending so many years of study into our own pathies, and we have our own clinical acumen of doing analysis as well as treatment. And these people had directly said that we cannot claim that our medicines can cure patients. Now, my question is, if you are not going to allow us to claim, then you are asking for proofs that how is your medical system or the stream, you know, authentic, or is evidence based? Because currently this big question that is we all are facing is how to prove your evidence based pathy. So all these things, and like what Dr. Sethia also said, Dr. Ramya said, everybody was treating during those days and they have already cured those patients. So of course, I think many of the doctors will agree to me that when we are treating patients, mostly we do have our own case papers. We do document things. So, you know, if officials would have asked all the doctors to present their case studies, individual case studies, maybe go from bottom to top, city level, state level, get the analysis done, and, you know, include all grassroots level common practitioner, I think the picture today would have been totally different. I hope you all will agree to this, isn't it?
Yes, yes,
Anybody wants to
definitely.
share anything on this?
See, now, as you
So
said about the proof part, so it's like a relativity basically. If a person is all right, he's not interested in going for an investigation. He says, okay, I'm all right and I'm definitely free from the illness. There's a common man of India basically, not America. One. Secondly, if you go by analogy method, suppose there is urinary tract infection, I go for a routine urine, there are plenty of pus cells, I start my medicine without giving antibiotic, he takes my medicine, he comes back, again undergo the routine urine test, and there are few pus cells. What is the proof now? The remedy has taken care of infection as well as patient. But now you said it's a coincidence, it's a self-limiting. And when some other medicine is taken and same thing is done, it's a cure by virtue of that medicine. So there are double standards. So many examples can be given. By simple analogy, you can prove that individual doctors have managed COVID at different levels. Forget about emergency, forget about death penalty, forget about the 11th hour treatment. वो तो हमको भी पता है ना. We understand our limitations. But you can't do a blanket cover like this. And very false thing is that cure is a word wrongly used. Cure happens only once. It is recovery which is a point to be understood
Correct,
here very rightly, because asthma is cured, diabetes is cured, but cold is recovered. 10 times cold is possible, 2 times typhoid is possible, 3 times jaundice is possible. So
correct,
very framing is wrong. So my patients recovered with homeopathy. It's a proof, subjective as well as objective. But then when you are rigid in your rules and you want to make some people awkward and out of that box, these things come in picture. So in future, this care has to be taken for a community at large. We are having such a large community or the population. Can the one system handle all these things? The non-medical people are giving medicines at the cost of non-available doctor. Then we are qualified doctors, and which doctor would like to harm the patient? So simple thing, irrespective of pathy. ये कुछ ध्यान में लिया नहीं गया, and it's just that you can't treat, you can be add on, you can be supplementary. So it's like a notional thing. Are you giving a decoration to us or consolation to us? What's happening exactly? And we don't have a voice. If some article comes of this type, I have got 10 points to write. Are you going to publish my article? Then there is double standard now.
exactly,
In corner, my article is
exactly.
published. Why in the corner now? Why not on front page? Yesterday, I shared one article of Hindustan Times. If I write an article against that or in favor of the points in homeopathy, we're not going to publish this. So we are not bothered about this. What my objective is that homeopathy should go to a grassroots level. It should be such a rapid fire that every common man, every house should have homeopathic kit. Once they experience themselves, they can resist any kind of objection from the authorities, because experience is superior than any theory, any statistics. We can't live with statistics, we live with the individual experiences. And I think all Ayush doctors should feel right for this. And if this is union of ours or united approach of ours, I think we can go to the community at large instead of a court, and they will vouch that this is the best option to us as a primary option. I think that should be the message to
Correct.
them.
Dr. Ramya, you want to add?
Yes. Yeah. Actually, innate immune system is working against all pathogens first, as we all know. So infection is a healthy response of immune system. We cannot call it as infection as a bite of virus or bacteria or fungus. It is just a response of immune system. Nowadays students are taught from, I used to wonder when I see the textbooks of children, they are taught that antibiotics kill bacteria to kill bacteria, antibiotics are the solution. It is what is being taught in NCERT textbook of 7th or 8th standard. So what the students are fed in their brains is that whenever they think of bacteria, they are thinking of antibiotics as primary solution. So the trend itself from the grassroots level, it has to change. They are not only that any medical system is demeaned, but also our innate immune system is demeaned by that statement. When you gulp in antibiotics, only bacterial infection cure means. My son, in fact, asked his biology teacher, "Teacher, I have not taken any antibiotics. I might have got different infections. So how can you say that?" My son questioned that teacher very politely. So I felt proud of him, because such a kind of attitude is not there. Innate immune system is responding to a pathogen in a healthy way. People do not know that people who are having autoimmune diseases, allergy, dysfunction immune system, they are not getting infections frequently. And if at all they are getting infections, they are going to a very bad level because of immune suppression. Infection will not be detected in the early stage. They will be on HCQ or steroids or something. So infection will be recognized in a later stage. So infection as such is a healthy immune response. So whatever Ayurveda is advocating against infection is completely based on host factors and not on bacteria, virus or fungus. What we can do from inside. See, regarding diagnosis and treatment, the most important chapter, first, foremost, and the most important chapter in Ayurveda explained in all our textbooks is fever. Fever is considered as an independent disease. It's not a symptom. It's considered as an independent disease. And what all cause mechanisms, I mean internal cause mechanisms, are responsible for fever. Apart from infection, there are so many different factors which can contribute to fever. All these cause mechanisms are explored in our textbooks. Every logic, every algorithms for diagnosis and treatment of a patient with fever. I repeat, patient with fever. Fever doesn't mean COVID-19 H1N1 case. It's not. The patient is presenting with fever. So the patient has to be explored. Just before what the experts were speaking about from modern medicine and homeopathy, it's true that we are supposed to heal the patient. Evidence is to be brought from the patient. Healing should be, evidence of healing is important. It's not evidence of proving drug that matters. Drug and medicine are very much different. In Ayurveda, Bheshaja is the technical term for medicine. Bheshaja means it is intended for reversal of disease. Tadaiva yuktam bhaishajyam yad arogyaya kalpade. The definition of Bheshaja is that which is contributing to reversal of disease and producing health. And everything which is not medicine is also technically termed as abheshaja. Abheshaja. Abheshaja means there are two types of abheshaja mentioned in Ayurveda, badhana and sanubadhana. Badhana means immediate side effect. Sanubadhana means later side effects. So abheshajam is not to be used. It is mentioned that abheshajam asevyam. Abheshaja is to be avoided. So that makes very clear demarcation between what Ayurveda is doing and what modern medicine is doing. Modern medicine is working for benefit risk evidence. Ayurveda is working for healing evidence. We have evidence of healing. So if ministry is calling experts of Ayurveda to show, suppose a ward is opened in every district or every state, or at least in All India Institute of Ayurveda, we can easily show the evidence of healing in comparison to what is happening in other systems of medicine. We can show our evidence. So that is what is required to be done. Healing is always natural process. Evidence is required in the patient and not in the drugs. That's my point.
Right. Dr. Saurabh? Unmute yourself, Dr. Saurabh.
Sorry,
Please
so
unmute.
sorry. So I heard
Yeah.
everyone, and everyone was Dr. Sudhir actually mentioned everything that comes in the principle of naturopathy. And whatever we are all are discussing, it is not, you know, uh, it is not contradicting to each other in terms of
Yes.
in terms of perception, like how we view our patient. And whatever has happened as a protocol, whatever has happened, it was very insulting to every one of us. And it was like we were getting insults if we were talking about COVID as a Ayush doctor. We used to get bashing from internet, even if we used to do all this awareness thing. So later on, when suddenly many doctors came up and started creating awareness about what is happening, what wrong is happening, so certain kind of confidence started coming in to a new doctors like me. Okay, and I was in an internship during that point of time, and suddenly the college was closed, hospitals were closed, everything was closed, and we had no hope. Like as if you are the only one here who knows what is the truth, and nobody is seeing that, even your own teachers and your own fellow colleagues. So it was, and after seeing all of these doctors started coming in, senior doctors, it gave me a lot of confidence, and I started treating people again. Whatever I had, whatever space I had, I started doing that. So anything else?
Right. Okay. So, Dr. Sudhir, anything from your end you want to talk about this?
Yeah, about this evidence-based medicine, like whatever
Mm-hmm.
the research papers are, no, if you really go into the depth of it, they are like doctored. No, not all evidence is put forth. Most of the papers, they will be like manipulated by the companies who are interested in that. No? And in medicine, there is never 1 + 1 = 2. I will again say that when you have a X outcome, it is not necessarily because of something you have given the patient. No, including cancer. I have seen patients getting cured, including cancer, without the doctor's help. Because if you say that X medicine is curing a disease, then if there are 100 patients, at least 99 of them should show the same result, which is never there. Maybe 50, 60, and there is something called placebo, nocebo. You know, if you have to study these things, there is a placebo effect also. Like if you patient actually cures by faith. I have seen this working. See, I worked with Dr. Vasant Pai, who was my teacher. You must have heard, people from Pune must have heard of his name. His patients used to come to the OPD, and if there was a lot of rush, they would say, "We just want to see him from the door." They would see him and go away, and they would feel better. This is not something scientific. These people had healing touches, and the patient had total faith in these doctors. So faith is a very big component, and education also is required. Like if you analyze the whole status of the society today, we are totally dictated by the pharma. Allopathy is taken over by the pharma industry, and whatever they say goes. Whatever they say goes. Like doctors learn from the pharma industry. We learn from AMRs. I'm sorry to say that, but we learn from AMRs. If there is a new medicine, they will come and tell us the effects, the side effects that they want to tell us. And we as busy doctors, we will not go into the details of it. And then we will say, okay, we will start using that. Over 40 years, I have seen this happening. Like I have started with penicillin, and now thousands of rupees are spent on antibiotics, and the patient will not get benefit. When penicillin was like, if I gave it today, the next day the patient would be happy and free of symptoms, But now, like if I give him 10,000 rupees worth of antibiotic, also he is not getting well because of the wrong concepts. Germs, I think, are not our enemies. I think they are nature's cleansing agents. I am repeating myself, but I personally think germs come into the body when the body needs some cleaning to be done. And if the body can be cleaned properly, the germs will do their job and go away or become dormant. They will stay with you otherwise. If the body cannot be cleaned, and the evidence is not there in the reports, even if you do a CT scan, it is not going to show you whether this body is healthy as per nature intends it to be. So if the germs cannot clean it, then the body has to be destroyed. Nature is very strict and impartial. It doesn't differentiate between pathies and differentiate between people. It has its own agenda, and nature wants to perpetuate life. It is not there to destroy life. Nature is never going to destroy. The word nature means to nurture. So unless the thing is totally incurable, nature will not destroy that body. So this is some experience I have gained over the years. I may not be able to give you evidence for this, but this is my general understanding, that germs are not our enemies. They are there by nature is not stupid. Nature is designing things beyond our imagination. Nature is working beyond our imagination. No doctor of any pathy can claim that he understands how nature works. Only some part of it we know, maybe 1% or even less we know. The rest of it we don't know. So we have to look at nature for understanding. And for remedies also, we have to look at nature.
Right. I agree. So I think after the listening to this history, what next comes into my mind is one more point is, do we really have regrets of something? At least I have. I feel that I was not much into activism, to be very frank, because nowadays we all see, today also this program is being done because of platforms which have been even earlier, but we never used to have so many kind of webinars and such topics. We never used to cater, I feel. But after this, I really felt, even during those times, I remember I joined Twitter only for this, because I wanted to express myself and I had no other medium to reach to public. So it started with that, and getting connected with people. I wanted to share my experience or give my views as a registered homeopathic practitioner, so that people become aware of different narrative also. So one regret is that. And another thing is, I feel we need to bring more and more doctors together. Like today we are having dialogue, isn't it? So similar kind of dialogues, we should help more and more doctors to come here on such platforms and share their views, and get together to bring some solution as such. uh, so yes, I will just quick one line I would like to hear. What regrets do you have, Dr. Ramya? Any regrets?
Frankly, turning back, I don't have any regrets so far, because during all the tough times I was fighting alone. I would say alone, but even though I am backed by a community of SBEVA, science-based, evidence-based Ayurveda, which I have pioneered, and I have developed with along with my husband, Dr. Rajkumar. And yes, there is a very big community of doctors whom we have been training the specific guidelines and principles of diagnosis and treatment of all the conventional diseases, all forms of diseases, with Ayurvedic, scientific Ayurvedic diagnostic and treatment principles, which we have emerged right from 2003. We have been doing work, we both, and then from 2015 we were giving training programs to Ayurveda physicians, students, and also, as the term implies, doctor means it is derived from docere, which means teaching. So it has got a very important impact, and fortunately I was placed as a medical faculty by God, so I was able to do justice in my profession, I believe. And I was able to render education to a large community through Facebook. I have joined Facebook only for the purpose of educating people regarding my system of medicine and truth about the pandemic, yes. But before that also I was on Facebook for education. So frankly, and one thing I would like to say that I was able, I means being in government service also, I was able to successfully fight and win all the odds I faced, all the strange odds, many of the strange odds I faced during the pandemic period. And I would like to uh, I am greatly obliged to Honorable Supreme Court of India for emerging their strong decision about the things. So I am really thankful to God for that. And yes, Dr. Gayatri, I don't have any regrets so far, and I look forward to serve mankind in a better and best way in future.
Okay, good. Anybody else wants to share? Any regrets?
No question of regret as such, but rather it made us more optimistic that we can do the things more better, more confidently, and we understood the flaws and limitations and the games which are played. So we know the all rules of game now. So we'll be more better placed to treat community at large. I think that was a gain of all that contrast.
Exactly. Exactly. So yes, now I think lot of past. Now let us go towards the
I would like to
present.
say something. Hello.
Yes, sir. Yes, sir.
Yeah.
Please.
See, whatever happens, happens for the good. That is
Good.
my
Yes.
philosophy.
Whatever
And
happens, happens for
nothing,
good.
see, again, I will go back to the nature. Nature is absolutely super intelligent and it will not allow any wrong thing to happen. So, whatever happens is for the good, no, for general good. It may appear like for the individual that it is bad at that moment, but it is always good in the general interest. So I believe that there is nothing wrong happening. Everything is happening with a definite purpose that nature wants to happen. Now, this platform, it could not have developed so well without the COVID. Almost every household can interact. Now we are using this to talk to our family members at any distance now. Even abroad, we can talk to them, have video chats. But this was not possible before COVID. We didn't even know that. So there are good outcomes also. This conference, if we had to arrange somewhere in a hall or somewhere, like you can imagine how much effort we would have to put. Now we are sitting at home and talking with each other and hardly any expenditure except for the internet and some electricity. So everything happens for the good. That is my personal opinion. Thank you.
Okay. Yes. So now let's go to the present. So today, actually, our topic, if what we have decided is, should Ayush Ministry of India join hands with WHO? This is today's topic, isn't it? Now let's first, let me ask you all one thing. Uh, we all are coming from different backgrounds, medical streams. Are we all aware about what is TCIH? Dr. Ramya, Dr. Pradeep, if you know, please do thumbs up. What is TCIH?
No
I
idea
don't
till
have
you
any
tried it.
little idea about
No
it,
idea.
but
No idea.
No
It is
idea?
something like at WHO itself. Traditional, something related to
Yes.
traditional
So,
medicine.
why I'm asking, why I'm asking this question is because I'm sure many of the doctors practicing at grassroots level, I'm sure are not aware of this group, that is traditional complementary integrative health group. This is only recently I came across. Actually, CCRH, that is Central Council of Research in Homeopathy, on its Twitter handle had openly put an invite regarding one Zoom meeting that happened somewhere in July. And it was organized by this group called as TCIH group. And it was organized between WHO and civil societies. The Zoom meeting was regarding that. Okay, so Minakshi, can you please scroll for us TCIH frequently asked questions? I have shared with you one link. Yes. So, who started this initiative? If you see, I will just I will just read out. This initiative actually is a grassroots initiative launched by an international group of sponsoring organizations of healthcare practitioners, patients, and scientists, and is being supported by a large and growing group of stakeholders from around the world who share a vision for how healthcare can be improved. Details on the sponsoring organizations can be found here. Oversight of TCIH declaration is carried out through collaborative decisions and discussions between the sponsoring organizations with input from stakeholders. Actually, there was some declaration which was signed, from this group. And this group has grown to such an importance, as per me, that it has organized this online Zoom meet with Director General of WHO, which is Dr. Tedros. And civil society groups were also invited for the same. And fortunately or unfortunately, I got to attend this Zoom meet. And hence, actually, I planned to do this today's webinar with you all doctors. So, what happened was I was not sure of what this group was about, because we all come from integrative practice, right? We nowadays, even being a homeopath, we do suggest certain uh, about naturopathy, how a patient needs to have his diet or something. So we all usually try to integrate our practice quite a lot. But I never heard about this TCIH group. And when Dr. Tedros was giving, affirmations about how we can join together, most important person was Dr. Raj Manchanda, who was formerly director of CCRH. He happened to attend the Zoom meet, and he also was quite affirmative regarding this TCIH group. So, a lot of questions came to my mind that now, if you all know, and I don't know whether even viewers are aware of this, that Ayush Ministry has already joined hands with WHO, that is World Health Organization, and it's only one global center is being built up in Jamnagar, Gujarat. And recent in maybe a week or so, there is going to be a very big discussion on those grounds, wherein different kind of policies are going to be discussed between Ayush, WHO, and this TCIH and other civil societies and all. Now, Minakshi, I would request you to just show us WHO website, which is promoting this TCIH group. Can we have that? If one goes on this WHO website, today you will be able to see discusses priorities on traditional, complementary, and integrative healthcare with civil society. And everything about this meeting is mentioned in that. About the group TCIH, it is mentioned in that. Any viewer interested can go to the WHO website and have a look that how much WHO is affirmative about the working of this group. And even AYUSH ministry also seems to be affirmative regarding this group. Now, me being a grassroots level registered medical practitioner, I was not aware of these things happening. So my first question that came into my mind was, are other doctors also aware of all the things which are happening in the background? That is the question we need to ask ourselves, because what happens is when question comes about discussing, Minakshi, you can just stop this and place everybody into one screen. Yeah, thanks. So my view over this is that we being practitioners, how much are we included into policy making, isn't it? Because whatever policy decisions are taken by the officials, we never understand what is happening. And suddenly when something crisis, health crisis emerges, we come to know about many new things. And we come to know that, okay, this policy was already discussed since 1 year. We are not aware of what is happening, isn't it? So, my question, I would ask you all that when we are not aware of all the things that are happening in the background, politically or regarding policy decisions, so do you feel the need that we as doctors should know about it? And we as doctors should have some scope wherein we can show our own involvement in that. So please share your views regarding this. Anybody can start.
Yeah, Dr. Gayatri, I am sorry, I just lost the connection in between. So I was not able to
Okay,
view
okay.
the things which you have shown here. I just
Yeah,
joined back only.
I
Yeah,
will
but
ask
it's okay.
Minakshi to just roll
Yeah.
back that again. Minakshi, WHO website, you need to just show ma'am once again. Yes, ma'am. If you go to WHO website, World Health Organization, you can see that WHO is writing a lot about this TCIH group, that is Traditional Complementary Integrative Health Group. Like I said, I was not aware of this group, and it is rightly stating in that article about it in a very affirmative way, wherein even Ayush Ministry is being very affirmative towards it. See, Dr. Tedros said, she's highlighting complementary and integrative health knowledge. And so my question today is that only, that we are not aware of these things, and how far we as doctors should be involved into at least expressing our views regarding what policies need to go in what kind of manner, because finally they are going to affect us on in our day-to-day practice, and especially when a huge health crisis comes. So we need to be aware of what is happening in the background also, and we should time should not come wherein we are perplexed and surprised to find something out of blue. So that is what I'm asking, like, please share your views regarding this thing.
Yeah, actually, this tradition and complementary integrative, that TCIH,
I
that I, yeah,
PCIH.
that I am coming to know now only. But I have been trying to demarcate the term tradition from Ayurveda for such a long period. I have given so many proposals to Ministry of Ayush. Actually, Ministry of Ayush comprises of other medical systems, Ayurveda, Siddha, Unani, everything. But as far as Ayurveda, every medical system, as I understand, has its own independent identity. Independent identity is there. So when everything is compiled together and addressed, each and everything is losing its own what you call independent potential identity and other things. So Ayush means it is not Ayurveda. That is the point which I am trying to communicate. We can communicate with WHO only through Ministry of Ayush. So we have been communicating directly to Ministry of Ayush through many proposals. The first point is that Ayurveda as such is not a tradition. The tradition is defined as by WHO as a set of idea, belief, culture, experiences transferred from generation to generation. That is the WHO definition for tradition. It is a set of beliefs, idea, culture, experiences transferred from generation to generation. But Ayurveda is science of life. Science is derived from the word scientia. Scientia means knowledge. Ayurveda means knowledge of life, science of life. But nowadays, when it is addressed as tradition, then and there itself, further things are getting distorted. You
Correct.
know, the science, identity of science is entirely different from identity of tradition. Tradition needs some validation, whereas science needs validation by science. There are inbuilt scientific methods within science. You cannot prove mathematics by chemistry. You cannot prove physics by biology. Every discipline of science has its own scientific logics, its own scientific algorithms, its own scientific method. Nowadays, scientific method is distorted. What is considered as scientific method is inductive reasoning oriented. It is like there are two kinds of reasoning, deductive and inductive. Ayurveda is a deterministic science. Deterministic science means it is led by proven and established things within the infrastructure of the science. It comprises of theorems. It doesn't have any theories. We are having theorems, siddhantas. Definition for theorem is given in Ayurveda. What is theorem? Siddhanta, parikshagir bahuvidam parikshya. Hedubhir sadhayitva stapyade nirnayaha, which means cause effect, cause effect relationship is proven and established by certain methods. The methods are explained, cause effect relationship is explained and established. Stapyade nirnayaha. It's not probability. It's not like maybe, may not be. The fundamental things which are already proven in Ayurveda are siddhantas, sutras, tattvas. All these are the fundamental aspects. Laws are there, laws of nature are there. All these cause effect relationship is proven and established. So they are not theories, they are not hypotheses. The fundamental knowledge is science. So deterministic knowledge, just like mathematics, physics, Newton didn't apply statistics to find out the gravitational theory. Einstein didn't apply statistics to find out theory of relativity. They have all followed the determinism, knowledge of determinism. Because when we go for inductive reasoning oriented approach means based on observations. Today you are observing one, you are documenting. Tomorrow you are observing another one, you are documenting. You don't know when you will be able to effectively validate these observations because you are never able to explore the causal relationship. That is the basic thing. So you are every day you are updating, but there is no truth or there is no reason to approach truth also. This is called inductive reasoning. But Ayurveda is a deterministic science which requires validation by inbuilt evidences, inbuilt science-based evidences. So what we have to prove is the success or the effectiveness of our theorems, diagnostic principles, treatment principles, how to understand COVID-19 in Ayurvedic perspective, or how to understand viral fever in Ayurvedic perspective. This is explored by us, me and my husband. He has written a book also, Unveiling the Truths in Ayurveda by Dr. Rajkumar. In that, for the first time in the history of Ayurveda, what is the viral fever? What do you understand by viral fever in Ayurveda is explored. What do you understand by typhoid in Ayurveda? What do you understand by malaria? So the evidence begins from within science. Evidence doesn't begin from outside with an unknown compound. In modern medicine, everything is beginning from an unknown compound. And it is comparing unknown compound with less unknown compound. No, more unknown compound with less unknown compound. So anyway, there is no completion. But that is not the case in Ayurveda. The cause-effect relationship for all the medications which are documented in the science. And before medications, there are diagnostic and treatment principles which can be applied in any disease in human being as long as the human being stays in the form of human being. As long as human being exists fundamentally as human being, we can apply these tools, algorithms, and laws and principles to intervene upon the man to diagnose and treat the diseases. This is the success of Ayurvedic science. So what is happening is when WHO is considering Ayurveda as tradition, we are losing our opportunity to stand independently on our own foot. We are not able to apply. See, we are having vast research methodology. Ayurvedic research methodology is explored in Charaka Samhita, in Ashtanga Sangraha. How to do research in Ayurveda, how to explore, how to validate. Everything is written in our science. But we are now currently, we are in prison. We cannot do our research methodology. You know how dangerous it is. How dangerous it is for the medical system as well as for humanity. We are able to explore the science. We are able to bring the maximum intended effects by our science only when we are provided the freedom, liberty to what you call apply our science, know and apply our science. This is restricted today. Today, a researcher in Ayurveda is supposed to follow this biostatistics and research methodology, which is based on inductive reasoning, which doesn't apply for a deterministic science. So these points we have written and submitted to Ministry of Ayush. We need to change. We want a complete independent research methodology to prove and explore ourselves to get maximum potential. But unfortunately, no, don't know why, Dr. Gayatri, they have not responded till date. It has been now 2 months and more that we have submitted
That is
proposal.
what I was going to, yes, that is what I was going to ask you, that what is the response that you got?
Yeah, this is what I also wish to speak on this platform. This is a very unfortunate thing that even though we have submitted with
Very
pros and
valid
cons,
point.
and also interesting thing is that me and my husband are kept in this expert committee for standard treatment guidelines. So when we started speaking about the need for complete revision in existing research methodology, clinical methodology, proving, showing, see, science is to know, data is to show. This is a difference. Data cannot prove anything, data can only show. Science is required to prove, science is required to know. Science of Ayurveda, I mean. So when we are trying to speak all these things, we are muted. We are not allowed to speak. We are not allowed to show the results. We are not responded. Can you imagine such a thing? How painful it is. Being an honest researcher, scientist, and clinician, when we
Definitely.
write the everything and with results, we are sending so many times. Right from before COVID, also, we have started sending proposals. But there is no response. We requested for a symposium where we can address these things on one day. But unfortunately, I don't know the reason still, but it is not happening. So, what you have said is correct only. So, regarding this project, what WHO is speaking, I don't think, frankly, there is any benefit, any minimal sort of benefit to Ayurveda and to humanity through Ayurveda. Whatever is done in the label of Ayurveda, it cannot be Ayurveda because Ayurveda is science based, evidence based medicine. It is not unknown compound based, data based, probability based, evidence based medicine like what WHO wishes to do. That is not applicable to the science of Ayurveda. So, this is what we are failing, even though truth is there, truth is blocked. So, that is where we are standing now, right now.
And main thing is that Ayush being see, we consider Ayush our own, isn't it?
Yes,
But
yes,
Ayush
strongly.
not responding on to this cannot be
Yes,
accepted when we
it's
are
very, very
registered
sad.
under
Very
them.
sad. Yeah,
It's very sad
exactly.
and pitiful situation, I feel, and it's a concern actually. But what happens is, most importantly, I feel is many of the practitioners. I'm sorry to say this, but it's a fact that many of us are, busy into our own practice, into our own patients. But we need to really think apart from our own practice and really show concern about all these happening, at this official end. That is what I really feel. Dr.
That's
Sethia,
what.
what you have to say about this? Dr. Ramya has absolutely put a very important point. After when I heard her, even I am now feeling that yes, it is so true that we all are being labeled as under traditional system of medicine, isn't it? So there is no science. You feel so. You have 30 years of practice in homeopathy. You have seen so many patients till now. So, do you think that it is not science that we are talking about?
So things are crystal clear for everybody, but those who are mimicking that they are blind, we can't make them aware of this. The very move I feel is because of insecurity on other side, because these alternate systems are growing at a very large scale, and a common man is happy with the modalities of alternative systems of medicine, the cost effectiveness, the personalized treatment, and individual approach. I think they are most important factors of all Ayush faculties basically, as compared to the other side of the story. Now, if WHO really is interested in this Ayush kind of a branches, they should first openly accept that these are full-fledged independent medical sciences having their own scope and limitations. Point number one. Point number two, as far as homeopathy is concerned, every year there are articles from Lancet to different papers that homeopathy is placebo, homeopathy is what is that. But for last 200 years, it is surviving consistently, and the data say that it's second largest system growing across the globe. So this is a threat. If we are minor, if we are placebo, why are you worried about us? We have our own growth and we have our own planet.
Exactly.
You should not come in picture
Exactly.
when you want to come in a picture. So we are making a difference, and every dog has his day. Our time has come, and no idea, no thing can resist us because a common man with us, first of all. Then there is a decorative community who wants all pathy as a treatment for them, but they are basically healthy. They don't need any pathy in a way. Rather, a real need of these pathy is a grassroots level, villages, common man who can't afford the so-called technology. Now there is less medicine, more technology, and people is paying for technology, not for a medicine. Are we practicing doctors or engineers? If these questions are asked, they're painful for the others. So if WHO wants to come with us, first announce that these systems are accepted as at par with modern medicine. One. Secondly, the limitations we can highlight and accept openly if we discuss together. Every faculty person should be there on WHO panel to take any final decision, and there should be a consensus. Then there should be equal funds to all pathies to research. You are sidetracking other pathies. 1 rupee for all pathy, 100 rupees for other pathy, and still you want to say run. This is too much. And your grammar of WHO has gone in last 2 years, that these people also know. So you come, we are very open for you, no doubt about that. But your agenda is very clear. There is no double standard. And most important thing is that as far as homeopathy is concerned, there are so many criticisms, objections, and people are quoting WHO for that. So let us understand that what is the WHO stand as a policy about homeopathy, and then only we can think that your motive is clear. We are always with you because the larger interest is patient. Neither you nor me or WHO is important. A common man in my country is important. I am answerable to that person. I think that's my view about this WHO business. If they are right, they are right. And if they are not right, they should think differently. Thank you.
Exactly. Exactly, sir. Dr. Saurabh?
Yes, yes. So I heard both of them, and I agree to the tradition part and also the motive part. What is the motive of WHO or TCIH, whatever the policy are there? Why we are not aware of it? And because as I am the person coming from the most sidelined pathy, which is naturopathy and yogic sciences. So when you see Ayush, Y stands for yoga and naturopathy. You will be surprised to know there is no central act like CCIM was an act uh, of 1970. Okay, so you have a law centralized law for running Ayurveda or homeopathy or everything. But there is no centralized council for naturopathy, and it is slowly getting sidelined. So they are just considering yoga and fitting anywhere they want. Like in Ayurveda and yoga is getting associated now. There is no naturopathy in yoga. Why naturopathy and yoga are associated? Because the principles are very similar, and yoga has nothing to do with Ayurveda or anything else. They are independent. And one more thing, integration. When they talk about integration, we lose our independence. Now, I have seen naturopathy people practicing Ayurvedic. They are prescribing Ayurvedic medicines. They are prescribing allopathy medicine for emergency use. Why? Because there is no regulation. And in Ayush itself, there is no union. There is no equality. There is no, there is no BNYS graduate in Ayush ministry. Nobody is there. There is one council, CCRYN, just like every research center. We have research center, but we have no regulatory body, which which motivates quacks, which motivates frauds, which motivates education frauds. So there are many people who are getting into it, and whatever the motive of PCIH is there, we are already fighting with Ayush to get a right and equality.
Exactly. So now our
And
more
now
group is
WHO is
joining.
coming.
We have to fight.
Yeah. WHO is coming and taking over everything. Now, Ayurveda is also in danger. Unani is also in danger. Everything is in danger. We are already in danger. We don't have any regulation also at national level. Every state has different policies, different syllabus. I had to learn Ayurveda for what? As a diagnostic. Uh, my syllabus was filled with Ayurveda because I was in the Jamnagar University, Ayurvedic University. So they made their own syllabus for us. And in South, if you go there is different syllabus. They are completely based on modern allopathy, whatever pathology, whatever subject they have. So we had to learn modern also, Ayurveda also, and naturopathy also. So I don't think integration is possible with anybody because everybody has different perception. And in naturopathy, there is no drugs. We don't prescribe anything. We only whatever manipulation we do it from outside. What kind of hydrotherapy they need, what kind of temperature they need to assist the body. We don't believe in suppression of anything. So that is why I was not saying anything when you guys were speaking about evidence based. Already, Dr. Ramaya said we are working on healing evidence, right? We have healing evidence, but we don't have what the proof they want. We don't have. And now, after this international bodies coming in, it will create a lot of chaos for everyone, I guess. Thank you.
Yes, Dr. Sudhir, what is your view about WHO?
See,
Now, till now you were
WHO
facing WHO. Now WHO is involving us also.
is WHO has hijacked everything. No, allopathy is hijacked by the pharma. The pharma is running the WHO, and WHO is now trying to hijack the other pathies also. I think all of you have to get together and resist it very strongly. Otherwise, you will find that you will not have any standing. Now, as a allopathy doctor, I know I don't have any standing. I have to follow protocols. If my patient goes to the court and if I have not followed a protocol, I will be held guilty. And the protocol is not decided by me or my experience. It is decided by the WHO, which is run by the pharma industry. So this is a very vicious cycle. And we have to focus on getting out of their reach totally. It is like, Ravana, you are shooting at the head, it will never happen. Ravana's life is not in his head, it is in his heart. So we have to teach people teach the society that without medicine we can be healthy. And I think Dr. Saurabh, your pathy is going to be the leading pathy because you are teaching how to be healthy without pills. That is very important. Unless you get rid of these pills, you are not going to get out of the clutches of these people. And it is very much possible. Nature has designed everything like that. No? It is very much possible. Now, Ayurveda is here for hundreds or thousands of years. Where are the factories in India? Where are the drug factories in India? The drug factories are the plants which nature is providing. No? Ayurveda lives, the Ayurvedic medicine comes from the plants. The plant is the nature factory for the Ayurveda. So, like for your this thing, natural this thing, sunlight is a remedy, water is a remedy, food is a remedy, exercise is a remedy. So, these cannot be patented or made in factories, and this is how we can get out of their clutches. Otherwise, we will never get out of their clutches. And trying to fight
Right.
on individual level is not going to help. We have to
Correct.
get united.
Exactly.
But the
Okay,
paradox
so
is this that
Meenakshi, can we? Yes, sir.
the paradox is this that even if we try to keep people healthy by our advice and guidelines and the principles, there is no glamour in it. And be realistic about it today's society. If I guide my patient how not to be a heart disease patient, how to maintain cholesterol, how to maintain heart health, how to take care of her exercise, the person pays peanuts. But when we go for a bypass surgery once or twice, he pays in lakhs. And it's a glamorous thing for him. He says that I underwent bypass, I went for knee replacement. But how not to go for knee replacement? How not to go for degeneration? If I guide like this as a grassroots doctor, the value is zero. So society also is a part of the story. We just cannot say that we are the responsible people. Our objective is very clear. The rather traditional systems, whether naturopathy, Ayurveda, they all teach health in the school or medical colleges, and no other system can teach health than the AYUSH doctors, because we have been taught basic that health is important, and if we get deteriorated, stitching time saves 9. But then in market, as sir has rightly said, the market is controlled by some other people. So they want to say that you are sick unless we check you. And screening is the biggest epidemic now. Screening में कोई ना कोई flaw निकलने वाला ही है. The moment you get some flaw, you are sick. The very definition of health of WHO is making everybody sick feeling, because you cannot fulfill all the criteria. So in a way, the Ayurvedic definition is more foolproof. Swasthya jo word hai, it is foolproof from indigenous point of view. And that is the most important thing, that definition of
Meenakshi,
health
is there
also needs.
any network problem?
Am I audible?
Yes,
No,
yes.
ma'am.
So if WHO wants to be a part of this story, they should redefine the concept of health or definition of health, taking into consideration as doctors. And I think that is a real honest sharing from their side. If they walk few steps, we can stop. We can walk more steps with them. I think that's the thing which I want to add. Thank you.
Okay. So, Meenakshi, can you please finally play the video of Dr. Tedros, because Dr. Tedros has given a lot of hopes and affirmations. We don't know whether they are really going to prove to what they are saying. So, let's just listen to the video clip.
An option, but you can suggest any other option. The most important thing for us is the regular engagement. What mechanism do we use to regularize our engagement? Then finally,
Are we able to hear?
Yes.
Not so clear.
overall engagement with civil society, as I told you, it started from the transformation. And we have the Civil Society Commission, we have Youth Council, and other mechanisms. So I think your engagement in those umbrella mechanisms will also be important, in addition to the specific, TCIH focused engagement with the relevant division. It will be important if you actively participate in the Civil Society Commission and also our Youth Council, because those platforms can also help the TCIH and what we have discussed today. So thank you so much again. I assure you of our commitment from our side. We're very glad that we have been working on the same issue, but different platforms. You have heard what we have done. We heard also what you have done, especially the last couple of years. I think it's a matter of now working together to move the agenda forward. And hope to see you in person in August during the summit in India. And of course, during our engagements in the future. So thank you so much. Thank you for your partnership, and look forward to take it to even higher level. Really glad to hear from you, learned a lot from what you said. We take it seriously, and almost all that you say makes sense to me. It's a matter of formalizing, incorporating it into our strategy and everything that we do for traditional medicine. But this is untapped wealth, and what do you call it? Deep well of collective wisdom that we have to tap into. I hear you very well, and you should believe that from our side there is a very strong commitment. Thank you so much, and see you around, and see you soon.
So, my question to the panelists here is like, so much far, 1.5 hours, we are discussing that what all we faced as a doctor and a clinical practitioner when WHO did not involve us, during the health crisis. And now WHO is very much interested into Ayush, and they are going to have this global summit, and they are close in hands with this TCIH group, which we practitioners are not aware of. And we don't know what policies are going to be discussed in Jamnagar in coming weeks, isn't it? So my concern here is like, what is the solution to this? So if anybody of you can just, within quick 2 minutes, because I think now we have 20 minutes, 25 minutes left. So can we talk about solution?
Yeah, I think what I think is the objective of WHO in doing this. One thing I think it will be ethnopharmaceutical and new drug development. They know that in Ayurveda herbs, Ayurveda formulations, there are so many active principles which they will be isolating. So, and they will be making a medication of semi-synthetic or like that, a new medication, and selling it in the market for some other disease as some remedy. That might
Exactly.
be monetary gains. That could be the, I guess so, because such things have happened before also. So what can be done is that only way is strengthening the Ayurvedic community. As far as Ayurveda is concerned, there should be strengthening of Ayurveda community. From the community proposals, it has to reach ministry, and once it reaches ministry should take care of not following WHO. Ministry should listen to Ayurveda community. This is my humble suggestion to Ministry of Ayush. Instead of listening to, because whenever we give proposal, ministry is asking us to follow the WHO methodologies. But the thing is that we are not graduates in WHO. We are graduates in Ayurvedic system of medicine. So our research methodology is prioritized by our science. So we should have sufficient freedom to prove our research methodology and our clinical methodology, whatever it is. So my humble request to Ministry of Ayush is that please listen to us. Please listen to our voice first before listening to WHO voice. Now, till now, they were listening to WHO only. They were not listening to Ayurveda community. So please let us talk. Let us have a symposium. Let Ministry of Ayush conduct a symposium where such proposals, renovation proposals for proving the independence, identity, and scientificity and potential of Ayurveda. And still, if WHO is interested in independent Ayurveda as a medical science, nothing wrong. It can be taken as like, let them listen to what we are doing, what we are telling, what we are submitting as evidence. Let them get convinced, and if they are convinced, they can take Ayurveda all over world, because Ayurveda is not anybody's patent. Ayurveda is a medical science, universal medicine. It is open to entire world, but they should have that open mind to listen to a medical science which is independent on its own, and let them do. So my only point of solution is Ministry of Ayush must take in immediate action, must reconsider inclusion of Ayurveda under traditional medicine umbrella. They should reconsider this, because Ayurveda is not tradition. And I'm very sad that many Ayurveda doctors are falling for this when they are invited for a conference
Exactly.
addressed to traditional medicine. Oh my God, we are invited for an international conference of tradition. I would tell my juniors and colleagues and students, please don't go for such conferences, or at least write a letter to them. I will be joining this only if I am invited as a panel from science, Ayurvedic science. Ayurveda is not a tradition. Please correct yourself. Let them, if they are listening, only call you. Otherwise, don't go for it, because we are losing our own identity and value. We are allowing
No, no,
ourselves.
but ma'am, Dr. Ramya, sorry to interrupt you here. My question
No
is
problem.
that if this Ayush ministry has gone at this stage and level, that means there will be many Ayush practitioners who are backing this, isn't it?
Exactly, and this is the reason. And unfortunately, they are given a very higher position in policy making. So there is no, just as what you told, there is no policy discussion happening before emerging. Even though I am a member of an expert committee in standard treatment guideline. Whenever I propose something, nothing is responded to. No response is received for my proposal, being a member of expert committee in standard treatment guideline of Ministry of Health. This is happening. So why it is happening so? There should be rethinking of all this. Then only any change can happen. Otherwise, this will continue as such. It's very unfortunate.
Exactly. Dr.
Yeah.
Sethia, Dr. Sethia, you want to say a few words?
Most important thing is that first of all they should be very clear about their agenda and objective. कथनी और करनी में फर्क नहीं होना चाहिए. Point number one. Point number two, from Wikipedia to WHO, they should take away all the reservations about homeopathy without any condition, if they really accept that as a pathy. And thirdly, those countries who are member of WHO should allow homeopathy practice as well as medicines, which is not happening. So this double standard will not entertain any way to us basically. So if these 3-4 conditions are discussed with the experts, and if they are solved out and sorted out, that will prove that your objective is very clear, your objective is pure, and you wish to allow the pathy to grow by its own merits, then only this can a right option, right I can say event or a right project. Otherwise there are a lot many fallacies which are not visible, because if they are made visible, question will be raised. And if you are not transparent, things will not go ahead, because ultimately strength depends on purity and truth. So I think truth should prevail. That's the only thing.
Right. Dr. Saurabh, anything from you?
Yes, yes. So as a part, I would like to add some solution, like whatever Dr. Ramya and Setia said. So I'm just adding into it. If there is certain things that is against our pathy, we should also take some suggestions from law. Okay, so as a physician, like we all are together, so we can take some suggestion from law and what we can do about it and how much we have control as a physician. So we can discuss that. And other things is be very transparent in the policy. Like whatever Dr. Ramya faced, like no response coming from the board, which is very unfortunate, and it should be like we all should come for that, and transparency should be with every physician there are in our country, because there are 10,000 plus physician for naturopathy and yoga, and 20,000 plus students where those are coming as a physician. So this policy making
Exactly.
and regulation, everybody should be aware of. And if nobody is ready to fight, we can fight, right? So that
Right.
that is my proposal as a solution.
Right. Dr. Jagtap, What
See,
solution you feel we should do? Should we get together and write to Ayush?
yes,
But we
yes,
are only four of us here.
that is the problem. In the medical faculty, no two doctors agree to anything. That is the whole problem. Doctors have never come together. If this was a situation with engineers or lawyers or any other faculty, you would find that all of them would come together on the street in one call. But doctors are like super intelligent beings, so they will never agree to even one policy. But unfortunately, like that is why people are dictating to us. Non-doctors are dictating to
Yes.
us. They don't even know what is medicine or what is health, but they are telling us how to treat. Hmm? But we have to like get over this thing and get together. Without becoming united, like it is not going to happen. All
Exactly.
faculties have to get together.
Correct. So
We can talk
actually,
to
on in yes,
we
you
can
said
talk to
something.
associations, yeah, the which
Exactly.
has
We need to talk
yeah,
to our own associations, I feel. And all of you, it's a request from my end to take today's discussion forward in your own group of people and doctors, okay? And try to connect with them. And maybe in the background, we can still come back together and do something about it as a real solution. That's what I hope. On the same context, actually, just for the viewers as well as for everybody of you, if you do not know, I'd like to say that I'm part of an organization which is recently registered, which is Universal Health Organization. And the basic idea of forming this organization has come up from all these 2-3 years of crisis only. And the main motto is the transparency, empowerment, and accountability that UHO would like to have upon the facts and figures and evidence from all us practitioners and medical streams in general. So please do share the word about this, and probably in near future we would start with the registrations also. And we are just as a part of Universal Health Organization, we are just trying to counter the flaws that WHO has, and to build a better system and bring in all the doctors who are like-minded together. So that is the basic idea. And another most important group that is doing very good work, I would say, is Awaken India movement. Because today I'm here because of Awaken India movement, to be very frank. Because the real connection that I got with like-minded people is because of Awaken India movement only. That is the first thing. So they are really doing a good grassroots level work. They are trying to create awareness, going into parks and public and talking to people, which we doctors, we will sit in our own clinics and maybe just talk with the patient. But going out and talking with a mob of people is a different scene altogether, and giving the whole idea about where things are going wrong, what should be done. So I feel these two initiatives need a big backing and support from all our colleagues and doctors, I feel. And even to the public, I would request, to just go through their websites, and for yourself, you go and see what work they have done. And if you approve, please do join these groups, because we need support. And only 4 or 5 of us coming together on Zoom platform or webinars is not going to be enough, because I'm talking here today, but already few decisions have been already taken by Ayush and who, and we are doing nothing about it. So I'm really, it's a huge and big concern that what is going to come ahead. So after listening to you all, I really feel it's my personal opinion that Ayush should seriously think again about joining hands with WHO. And if Ayush at all wants to join hands with WHO, it will be in buts and ifs. That is what I feel. Do you agree with this?
correct.
Yes, yes, by all means.
Exactly. So I think it's almost time. Anything more you just want to share? I would like to ask you all that how did you find this initiative taken by me and the Universal Health Organization, Awaken India Movement, and QWive Network channel actually, who is providing this platform, for doctors like us who can now, without thinking, can come on this platform and speak out of what we really want to say. Otherwise, most of the times we were muted so long that, okay, no, we are not going to give you a chance to speak and tell what you want to say. So I would really thank all these three organizations who are working very nicely. And I would like to ask you that how did you find this initiative, and should this continue every week or maybe at least bi-weekly or something, so that we connect with more and more like-minded doctors and have doctors dialogue like we had today. And I hope even all the viewers would have liked it. So please share two sentences about how did you feel about this initiative.
Gayatri, I think on a background of very loud panel discussions in newsroom, this was a very silent, straightforward, one by one discussion, and I think it is a contrasting thing. People are happy to do that loud noises and fighting in front of each other in spite of so learned crowd. We are so decently interacting with each other, not criticizing anybody, proactively doing the things. So whole
Exactly.
credit goes to you as a person and Awaken India movement. So I'm wholeheartedly thankful for you for at least giving a platform for a pathy like homeopathy, which needs this very badly because ours is orphan science in our country. There are hardly sponsored colleges, more are in number. And so if this happens, people will take cognizance of this pathy, and the Ayush should be very much concerned about all pathies together. And I think this should reach to Ayush also. Once again, thanks to all the panel members of mine and you in person. Thank you very much for this activity. Let's continue in
Thank you,
future.
sir.
All the best.
Yes. Dr. Ramya?
Yeah, Dr. Gayatri, it was indeed a big pleasure for me. And I'm sure I was really excited to hear the talks of other eminent panelists who are present here regarding their views, and we all are traveling in the same boat. So the thing is that, first of all, even though we are having many enemies from our own community, I think the worst part will be happening in Ayurveda only. I don't think homeopaths, I have seen so many homeopathy doctors who are coming up during COVID against all the odds. They were ready to speak up. They were approaching court for their rights. But as far as when I consider about other systems, even naturopathy, yoga, homeopathy, everyone was fighting for their rights. But I would say, very sorry to say the truth, but I would say if there is any professional community, which was majority of them were remaining unprofessional. I'm very sorry to use the term unprofessional, but without any language, without any voice, staying mute forever, like as slaves, as puppets. It was only from my own community, Ayurveda, and I fully take the responsibility for this pathetic situation. And I'm trying to change, being a, like what you mean, just a small share from my side, whatever can be done. And I find this opportunity as a great opportunity for the means of my work also. AIM has supported me so much in my personal painful moments also during this COVID crisis. And I'm really obliged to AIM and to you. It was really good to have with you all. Thank you for the initiative, and
Thank you.
please don't stop this initiative. I will definitely share this with my group
Recommend some
members.
more doctors to me so that we meet
Yeah,
again
yeah,
for
definitely.
a
I'm
new
sure
dialogue.
many of them will be listening to us, and I'm sure many of them might have motivated already. They will join you soon.
Exactly.
Best wishes to you.
Yes. Thank you. Dr. Saurabh?
Yes, very nice uh, initiative altogether, and I'm feeling very nice and very confident today. And it was the time when we were in lockdown, and everybody was talking, everybody was in fear, and suddenly this Awaken India movement comes up, and we all together started fighting against all this stupidity, whatever was happening. And again, the same kind of stupidities again coming up in the form of policies and laws. So we are getting alert at this stage is a good sign. And this initiative, I'm so grateful to you, Dr. Gayatri, for creating this. And we'll keep on doing this with you.
Thank you.
And, and I'm so happy that so many senior doctors are here. uh, understanding this,
Exactly.
understanding this problem that I am facing. Actually, I'm very fearful about my future right now as a physician and all the policies that are coming up. But as we are getting guidance from this senior faculties, we are there as a youngsters. We are there with you, and we understand everything, whatever we are trying to do. And I'm very happy to listen to all of you, especially Dr. Sudhir. I'm big fan of Dr. Ramya. I've I've been following her work, and also Dr. Pradeep Sethia, very precise, very point to the point. So I liked this conversation with you all, and thank you so much, Dr. Gayatri, for this amazing initiative, and we'll move
Thank you. Thank
forward.
you. Thank you. That is very motivational to me. And Dr. Sudhir Jagtap?
Thank you, all of you, especially Dr. Gayatri, for giving me this opportunity. And everything starts with the first step. So, like, we can hope that this will continue and we will be successful definitely. And for Dr. Saurabh, please don't worry. I'm sure your pathy in 4 5 years will be the first preferred pathy. I can give it in writing to you because
Thank you so
ultimately
much.
the patient is the king. The
Yes.
patients have realized that allopathy is not giving any answers and they are just cutting their pockets and throats at some time, you know. So gradually the word will spread that better to go to nature for cure because nature is the expert. Whatever human beings can say, nature is the expert. The ultimate teacher is nature, and nature will decide everything. So we can definitely have good hope. Whatever these people are doing, this ultimately is counterproductive because they have put their foot into it now. And people have realized that they are not working for the best interest of the society. They are working for the best interest of their bank balance. All this allopathy and WHO and everybody, they are working for their own personal interest. They are not working for the interest of the society. Otherwise, it should not take so many years to make the society healthy. And the reality is the society is becoming more and more sick. If these people are dictating and telling us how to cure people, then why is the society becoming so sick? Just one example I will say. When I was a school going kid, our society had about 144 blocks. You know, society, the whole blocks. And in that, only 2 people had diabetes. And now I'm staying in a society with 1,000 blocks, and every household has diabetes. So, have we made progress? So, should we be walking on the same path? We have to change the direction. We have to go to another system. If the society is interested in becoming healthy, that is one very big issue. But the society is not that stupid, also. Once we teach them, they will definitely understand. So, I am very hopeful that things will
Yes.
improve. Thank you.
So, so listening to all of you now, even I'm, I'm hopeful because your experience and your words and your views do matter a lot, and I feel that everybody, it's a request again to please, try to support even Universal Health Organization along with
Yes,
AIM. I would really say please go through the website also and do register it whenever we open the registrations.
Sure.
So I had a real wonderful time, uh, you know, to listen to each one of you. And of course, they are simply like golden words because this was a very nice dialogue that we had amongst each of us, and it was not a debate. So I think we stand true to what I had decided, that let's have a dialogue and not a debate, isn't it? So thank you once again to
Thank
each of
you.
you to give your precious time for this program, and really had a very wonderful time listening to all of you. And I hope that you will share today's session with everyone in future also.
Sure.
Okay.
Yeah.
Thanks a lot. We end it here.
Thank you.